Schneid guy.
So now we're going to talk about the effects of the autonomic nervous system on the atrioventricular node. Notice we have the AV node shown here, and we have the sympathetic nervous system, the sympathetic postganglionic neuron, releasing norepinephrine onto a beta-1 adrenergic receptor, which we see here is a 7-transmembrane spanning receptor that's coupled to GS, which means it increases cyclic AMP and protein kinase A. We see that the protein kinase A is going to phosphorylate L-type calcium channels, making them open better in response to their normal stimulus, which is depolarization. As more calcium comes in, the phase 0 slope and amplitude goes up, and I get an increase in atrioventricular node conduction velocity, and we call that a positive dromotropic effect. Now, if we look at the parasympathetic side, we have a parasympathetic postganglionic neuron shown here releasing acetylcholine onto an M2 receptor. That's a muscarinic 2 receptor. That's coupled to GI. We see it's a 7-transmembrane spanning receptor as well. And if we recall that GI-coupled receptors lower cyclic AMP, lower pKa. So we're going to get the opposite effect here on AV conduction, and we call that a negative dromotropic effect.